So, just to very briefly talk you through what's going to happen over the next hour or so, I'm going to talk a little bit about the background context for this inspection, about the policy and strategic context. We'll then have a chance to hear from Lisa Parker, who was the lead inspector on this work. Lisa joined the inspectorate in 2018. Had previously been a consultant and had worked in drug and alcohol services, and had also been an assistant chief officer in the probation service. And so she'll talk through some of our detailed findings from our field work and from the analysis that we did and the interviews that we undertook. And then you'll be hearing from Sunny Dadley, who is a consultant and a senior expert advisor, including to NHS England on the importance of lived experience in drug and alcohol services. He was also a really important member of the expert reference group, which we set up for this study, and was on Dame Carol Black's expert reference group as well. And prior to that, Sunny was involved running substance abuse services in Wolverhampton, developing the peer-led community service suit, and he himself has his own lived experience of addiction. So I think is very well placed to talk about the importance and value of bringing lived experience to this work. And then we'll have some time for questions. Next slide, please, Kevin. A bit of background context. I'm sure a lot of this will be familiar to very many of you, but it is just worth emphasizing the huge role that drug addiction and drug dependence potentially plays in relation to crime. Dame Carol Black in her report pointed out that a cohort of 300,000 dependent heroin and crack users are, we think, responsible for half of all acquisitive crime in England and Wales. At a cost of perhaps £9 billion a year. That represents a cost of £58,000 per dependent heroin or crack user. And in all of our fieldwork sites, we found really strong supporting evidence for that issue. In Middlesbrough, for example, a project working with heroin users found that 6 heroin users they were targeting between them had committed over 540 known offences at a cost of £2 million to the local population. We know that heroin and cocaine use have increased since 2013 by a range of measures, perhaps the most upsetting of which is the number of drug-related deaths that we now see in England and Wales, which reached a record level of over 4,500 last year, up nearly 60% on 2010. People will know that there's evidence of drug use and drug misuse in nearly all of the different criminal justice populations. A very high proportion of prisoners have experienced that. There's evidence from police arrest referral schemes, again, of very high rates of use. But this particular study was focused on people on probation supervision. When we undertake our local inspections, we look in detail at thousands of local probation cases, and we look for evidence of what may be driving someone's offending behavior, including whether that person had a drug problem which may have contributed to their offending. And when we analyze that data, we find that 48% of the cases that we inspect locally, we find that that person had a drugs problem linked to their crime. And if you multiply that up and look at the overall caseload, that means potentially that there are 75,000 people with a drugs problem potentially contributing to their offending currently under probation supervision. What is alarming, though, is the gap between that number and the number who are actually being referred for specialist drug treatment services by the probation service. And the latest data that we have on that suggests that fewer than 3,000 people a year are being referred to a drug treatment agency by probation. Why has that happened? Well, we've seen 2 particular fall-offs really in the numbers of people coming from probation into treatment. Firstly, in terms of people who are being referred by the courts for treatment, we've seen a huge fall in that. In 2008, there were over 17,000 drug rehabilitation requirements given by the court each year. Our most recent figure suggests that's down to only 4,000 DRRs a year, so a drop of 75%, in the number of DRRs being awarded. And then if we look separately at people coming out of prison and then being supervised by the community, we found that 2/3 of people leaving prison who have a treatment need are not then being linked up to treatment after leaving custody. So both in terms of people being given community sentences and people being released on license, there's this huge potential gap between treatment need and the people actually being given treatment. A big reason for that we flag in the report is the loss of funding and the loss of structures and criminal justice pathways over the last 10 years or so. And we talk about investment in criminal justice treatment pathways withering on the vine. If you go back 15 years, the drugs intervention program attracted something like £900 million of investment over the lifetime of that program. That program was wound up in 2013, and the previous ring fences, which had existed for drug abuse treatment budgets and for things like testing at police arrest, have disappeared with them. We did a survey of commissioners of drug services in England, and almost all of them told us that they'd had budget cuts over the last 5 years. And at least half of them said their budget had been cut by over 25% since 2015, and we know they suffered further cuts before that point. Just to flag that the situation in Wales was perhaps a bit better, and we found in our report that actually funding has been better protected in Wales, and that the area programme boards which commission services in Wales had seen an increase in their funding in the most recent years, and there's been continued investment from the Welsh Government and local PCCs and HMPPS, which has been welcome. And there's also a more joined up approach to commissioning in Wales as well. Having said all that, there are some welcome signs of investment going in more recently from governments, and people will know about Operation Adder, which has attracted £24 million for 5 pilot areas, and the Department for Health and Social Care has also put in an additional £80 million of treatment funding over the past year. But if we're honest, that's still a very long way short of where the need goes. Damon Carroll Black, in a report published last month, found that an additional 550 million a year is needed to actually meet the treatment needs that are out there. That investment will buy 60,000 more treatment slots, and potentially, she found, prevent 900,000 or more crimes a year. And as she very powerfully points out, investment in treatment is a very sound investment and more than pays for itself. It's not just about money, though. We found in our inspection, and Lisa will say more about this, that there is a real lack of a properly coordinated, detailed strategy for people on probation, which brings together the key health and justice stakeholders, and that also applies at a local level as well, except again perhaps in Wales. And we found real signs that treatment providers and probation are operating in very separate silos, and that really is not helping to coordinate the support and services that this group of people needs. And you'll be hearing a bit more about that from Lisa as well. I'm going to stop there. I hope that's helpful background context. There's more in the report itself, and I'm now going to hand over to Lisa Parker, who's going to say a bit more about the detail of our findings. Over to you, Lisa.
Thanks, Justin. Lots to rattle through, so I'll just locate you. So a little bit about the methodology, and then we're going to talk a little bit about the findings, and then a summary of the recommendations. So we looked qualitatively and quantitatively for this inspection. Qualitatively, we took 60 cases and did a deep dive, in-depth look with our partner inspectorates looking at the health side of things, and with drug services and in records on that side, and interviewing each drugs caseworker, and with HMI probation inspectors looking with the responsible officer and at the records. We looked at 6 fieldwork sites in England and Wales, and we undertook meetings with key players in each of the locations, so commissioners of services, community safety partnerships, adult safeguarding boards, judges and drug service providers and resettlement and prison staff. We co-produced the inspection methodology with the CQC and their partner organisation Choice Support, thanks to them, whose experts by experience helped us gather insight from people on probation, really important to make sure we hear the voices of people who are experiencing these services and what it means to them. Next slide, Kevin, please. So those fieldwork sites we went to Middlesbrough, Blackpool, East Sussex, and Swansea in terms of sites that came under the umbrella of Operation Adder, which is the mnemonic for addiction, diversion, disruption, enforcement and recovery, which Justin had spelt out in his earlier address. And then, so those were the Adder sites. We inspected in Wales with Healthcare Inspectorate Wales, and thanks to them, and then CQC helped us with the English sites, and on top of the Adder sites we also went to Manchester and Lambeth, which are community sentence treatment requirement pilot sites. Next slide, Kevin, please. So quantitatively, we looked at some big data to help us triangulate the quantitative findings with the qualitative findings. We asked for evidence and information in advance from all of the fieldwork areas who were very good to work with us so positively. We got performance information from the drug service providers as well. We had very generous amounts of time given to us from Public Health England, who shared their wisdom around what was available through the National Drug Treatment Monitoring System. We were supported by Welsh Government and their analytic capabilities, and HMPPS provided some bespoke data for us to have a look at DRRs and licence conditions particularly, so we could get a real snapshot of what was happening there. And then we ran 3 electronic surveys, Justin's mentioned, and we had an overwhelming response from magistrates. Nearly 450 magistrates wrote to us, very keen on this area of practice and want to see it done well. And we spoke to commissioners and probation providers. Thank you, Kevin. Next slide, please. So I've got 5 slides now, which I'll take you through the key findings. So we've got partnerships. So Justin's talked a little bit about the strategic position, and sort of leading on from that, it's important to say that we saw quite a fragmented piece. It's complicated business working across justice and health, and the way that services are commissioned, particularly in England, was often quite problematic in terms of joining up services, and there's quite a lot of working in isolation. And even in Wales, where some of the commissioning is more joined up, we still saw a lack of joint planning and joint delivery in all the fieldwork sites we visited. So that meant that plans weren't shared across, and interventions weren't always recorded, and it was quite problematic. Where we did see better join up, we saw some pockets of good work with local recovery organisations and some women's centres, and that did lead to better practice. Information exchange is a really crucial area, and we didn't see the information moving effectively across organisations to support people with drug misuse needs. It's fair to say recording is poor, and key pieces of information is not readily available on case notes. And at a more kind of macro level, the probation service is unable to really identify how many drug tests it takes each year and what the results of those tests are. So the management information needs to be bolstered. Many staff told us how they valued specialism and co-location and integration. However, we see very few specialist teams now operating. Most people do welcome that model, however, and we certainly advocate for it. And I think it'll be no surprise to the audience here today that mental health is a key and foundational issue to people's substance misuse problems. There are some good facilities across the country. However, not enough people are getting help with their mental health, and not enough thought is being given to how their mental health will intersect with issues around drug misuse. Next slide, Kevin, please. So court work, I think Justin's stolen my headline really here, but not enough people are getting into treatment. Justin shared with you some of the numbers around the very, very few drug rehabilitation requirements that are ordered at present. Those numbers have been in steady decline for a decade. Very few specialist assessments are being undertaken at court, and there's simply not enough proposals being made. And despite sentences being quite keen on this disposal, it's not happening for people who have some pronounced drug misuse difficulties. That said, we still saw some instances where sentences were making these sentences without any recourse to a specialist assessment, and sometimes without the person's consent. And obviously that doesn't quite attune with what the legal position suggests should happen. Next slide, please, Kevin. So key findings in terms of the casework and the interventions. I think there's quite a lot of information on this slide, and as I put in the chat, the slides are available to you on our website post this talk, so I won't read it all out, but just to give you a snapshot of what we found was that for the DRRs, we now find a really diluted model for what it was. I mean, obviously, those of you who've been around as long as I have will understand that the DRR was sort of was the new kid on the block after we had the drug treatment and testing orders. And certainly we are poles apart from the days of when those kind of sentences were being run in the community and people were getting lots of intervention, lots of support, lots of positive activities, and lots of monitoring as well. So very diluted model, very few are going back to court for court-based oversight, and very few psychosocial interventions were recorded. I mean, it's fair to say we do recognise we inspected in a pandemic year, and we may have seen a slightly better picture had we not. However, we have to report on what we find, and it's true to say that there were some services were finding ways to do alternative delivery and doing telephone interventions, etc. But generally speaking, very little was recorded in terms of psychosocial interventions, and very, very little testing was recorded for people on probation. In terms of diversity and trauma-informed approaches, where we saw this done well, it was fantastic. And I'm sure Justin will talk about our effective practice guide that will be published later on in the year. However, on a general point, these were not covered well within the assessment, planning, interventions and reviews that we saw. People's protected characteristics, their backstory were not well considered, and sometimes to such a degree that it really impacted on the ability of the person to get a good service. Similarly, the amount of trauma in people's backgrounds is quite pronounced in this highly vulnerable group, and we encourage more training, etc., to be put in place. Multi-agency work, where we did see that joint approach, it was much stronger. The work was much, much stronger. Unfortunately, it's happening in far too few cases. And then recovery. Those colleagues around the room who have worked in substance misuse services will be really familiar with the concept of recovery. However, it's not a widely known concept within probation practice, and very few of the responsible officers we spoke with felt confident around this. Next slide, please, Kevin. So in terms of resettlement and the journey that people make between custodial and community-based settings, you'll know that there's an awful lot of people who fall out of treatment, and around 65% of people who leave prison with an appointment don't get to those appointments. And there's an even bigger group who don't ever get the appointment in the first place. So we can see lots and lots of unmet need. Where we did see in-reach from the community, it did improve engagement planning and continuity. And that we saw that in terms of the model that's used in South Wales. one of the things we wanted to highlight in terms of positives was the fact that where long-acting buprenorphine, which is an opiate substitution therapy, where that was being used in careful consideration for people, it was showing some really interesting, encouraging findings. And people we spoke with, people who were using those services, were quite positive about those therapies to be able to stabilise. Not such a great picture with licence conditions. The licence conditions that were applied and the management of those conditions is incredibly inconsistent across England and Wales. And we found no consultation with drug services about suitability of people for licence conditions that included treatment, which obviously kind of runs counter to what should happen for community-based treatment options. Next slide, Kevin, please. So my final slide on the key findings. We were looking for harm reduction and overdose prevention, and we found that these issues were not being considered well enough. The brief interventions I undertook as a probation officer on the front line many decades ago seem to have fallen out of the culture of probation, and I, for one, would really welcome that to be a feature of probation practice. Certainly not something that most probation staff told us that they saw as part of their role. Naloxone, the drug that some of you will be familiar with that helps reduce and reverse the potential overdose from opiates. The rollout across the country has been happening at pace. However, the rollout across approved premises, the probation hostels, as some of you will know them, that had only reached less than 2/3 of all the premises by July of this year. Although where they are in place, I understand that they're really been welcomed. Drug-related deaths, Justin's already talked about that. I think key finding for us was that when people sadly do die, there's not enough learning or good practice being shared, and the systems are weak. And then safeguarding adults at risk. It's not being done consistently well. And as I said before, we saw incredibly high levels of vulnerability and the influences of organised crime. So those are the key findings, and I know I've rambled through them quite quickly. I hope you'll go back to the presentation in your own leisure time. And just on to the next slide with the recommendation summary. So lots of recommendations, 14 in total, and we've kind of grouped them together a little bit just for the participants for today's convenience. But we're asking for a number of government departments across justice and health, Welsh Government and local criminal justice boards in conjunction with HMPPS and local drug services to really start to evaluate where commissioning is working best and to learn and apply those thoughts. Crucially, to increase the number of people who can access drug treatment and recovery options. To build a really effective joint working culture between all the relevant professional bodies that are working in this space, with joined up strategies and policies to really help the people who are quite vulnerable and stigmatised, the people on probation. We'd like to see far more specialist drug misuse assessments at court, with better information exchange and a real place-based approach. So whilst we need some central governance and help across from the centre, it really needs to be place-based in terms of some of the stuff that happens on the ground, using evidence-based interventions that really work to help people tackle addiction problems and support their recovery journey. And crucially, it's really important that there's some measurement and publication of outcomes specifically for this group of people, so that we can see what's happening for people on probation and how effective the services are in helping them reduce problems with drugs. Next slide, Kevin, please. So for the newly formed probation service, we want them to implement a drug strategy with all the related policies which will have effective governance, and to have better information and data systems to profile the needs properly. We'd like a specific field which can record and give management information about drug testing results. We advocate that the implementation of a semi-specialist model should be put in place, as was in place some years ago, with a full and robust partnership. And we want to see an improved training to staff, particularly probation staff, on how to work with drugs, how to recognise signs and symptoms, and how to work effectively with trauma, and how to work effectively with recovery capital, and supporting people's development there. And really importantly, we want the safety of people under probation supervision to be improved so that there are less drug-related deaths. There needs to be effective learning programmes to deliver harm reduction and overdose prevention, brief interventions and messages, and there needs to be much better activity around safeguarding all adults at risk. Thank you. That's my slide. So I think it's over to Sunny now.
Thank you very much, Lisa. Very clear summary of our findings. There'll be a chance to ask Lisa some questions. Can you put your questions in the chat line if you'd like to raise a question about anything that Lisa or I have said, and we'll, after Sunny has spoken, we'll do our best to answer as many of those as possible. It might also be worth saying that the Ministry of Justice will be, as a requirement on them, to produce a response to our findings and to our recommendations. So we are looking forward to seeing what sort of action plan comes out of this inspection as well. But before we get to questions, let's move on to Sunny Dadley. I should say that an increasingly important part of all of our inspections, both local and national thematics, is to listen to the voice of people on probation, and we've greatly expanded the evidence that we collect from people on probation to ask them about their experiences, and that is now being included in all of our reports, including in this report, where we were able to speak to, I think it was 20% of the cases, the people involved in the cases that we inspected, and some very interesting insights from that. But we certainly see a really important role for people on probation, people with lived experience, as part of our inspection methodology going forward, and more broadly, I think, in the way that these services are provided. And I'm really grateful to Sunny for coming to speak to us about exactly that point, about the value of lived experience. Sunny, over to you.
Thank you, Justin. Can you hear me okay? Sometimes I have a bit of, yeah, okay, good.
Yeah, we can, yeah.
All right, thank you. So first of all, thank you for giving me the opportunity to talk about something that not only has my life experiences kind of led me towards, but also professional experiences. I won't go into a great deal of depth in terms of my background. However, I am a keen believer that those with lived or living experiences can add a great deal of value to helping to improve outcomes. And as part of this brilliant yet really kind of important report, I think, lived experience for me, it can be the thing and should be the thing that really helps to drive us to move forward. So I've kind of just thought about how I can frame this within the report, and the first point to make really is about understanding how professionals, and I say that in the broadest sense, can appreciate the expertise that lived experience brings. But in order for that to happen, we need to create an environment so that individuals who are going through the system, as it were, or have had experience of the system, can really inform thinking and practice. Of course, we've got some fantastic qualitative and quantitative information that's coming from the report, but moving forward, how can lived experience help to shape how services like probation deliver their services? One really key important element for me, and this is something that I learned through kind of developing peer-led lived experience services, was that if we can truly embrace lived experience and offer opportunities for it to impart influence, then what that will start to do, even at a kind of local level, will help us to understand how this system works. And when I say the system, I say that in its broadest sense, whether it's employability support, whether it's housing, whether it's the criminal justice system, whether it's health-based services. I think by giving an ear to lived experience at a local level will help to local services to understand how they're working or not with one another. One thing I would say is that, I learned so much about how, local systems work just by listening to people's experiences of how they felt when they walked into a service, if whether or not their needs were met. And I think by embracing this, then hopefully this will help us to achieve improved outcomes, which is what we all want. Now, one aspect of lived experience that I think is really important is about how lived experience can actually influence what's happening around us. So my call or my plea is to ask you, well, what opportunities are there for those with lived experience to exert positive influence? That could be on a one-on-one basis with a probation officer. It could be with other local strategic meetings that are taking place in a locality. So, what is being done or what could be done better so that we can start allowing lived experience to influence the system around us? I know diversity has been mentioned already in the report, but one of the key consideration for me is looking at how well developed equality, diversity and inclusion is across the whole system. What do we know? We know there's a disproportionality in terms of sentencing, for example, within the criminal justice system. And how does that relate to workforces, adjoining workforces, and also places of influence? So, how is our system set up to match the needs of the people that we're working with? And I think lastly, but really importantly, is are we willing to share power? Now, this isn't a call to any one individual. This is talking more at a societal level and a system level. So, an early experience I had was, trying to understand how different power dynamics work, not because, I wanted to infiltrate the systems. I wanted to understand why the system operates in the way in which it does. So when we're thinking about lived experience, how prevalent are things like stigma and just discrimination? Are there whistleblowing policies in place? Although there's a statutory requirement to manage individuals within the community, for example, within probation, is stigma and discrimination stopping us from achieving the type of outcomes that we're looking for? I'm not going to steal any thunder, but when we consider things like assessments, whether that's at court, whether that's at probation, are things like active listening practiced? Are we listening with a view to reply, or are we listening with a view to understand so that we can intervene? One of the stats within the report that I think it works out something like 3.9% of people with a drug misuse issue are being referred into treatment services, for example. That's just not good enough. So I think, we really need to understand how that lived experience and the living experiences of individuals are looked at in a very human-centered way. At the end of the day, we're dealing with human beings. People might have different experiences, they might have been down a different path, but these are human beings that we're talking about at the end of the day. And finally, one of the key aspects of me and something that I've dedicated a lot of time to and effort is around developing lived experience leadership. So this isn't to replace other forms of leadership that exist, but I think if we are to create the systems and achieve the outcomes that we're all hoping for, then how can we actively support individuals to progress into positions of power and leadership? I wholeheartedly agree with all the recommendations, and I think that lived experience could be the key to unlocking a better future for us all. Thank you.
Many thanks, Sunny. Really powerful stuff from you, and you're staying on to help answer questions as well. So do please put your questions in the chat box. We look forward to answering them. Thanks to those of you who are also sharing resources or examples of good practice in your own area. Some interesting feedback that things perhaps are going a bit better with DRRs in the West Midlands. Interesting to see that Probation Institute are developing some training on drugs for probation staff. So keep the effective practice advice coming. And I should say, I think Lisa mentioned this, that alongside our main thematic report, we're also proposing to publish an effective practice guide around substance abuse, which Lisa has been working on with our effective practice lead, and that will hopefully be published in September. Just a couple more things about next steps in relation to this report. I mentioned that there is a requirement on the department to publish a response to our recommendations, and I said we'll look forward to hearing that. I was able to brief the Minister Kit Malthouse last week on our key findings, who is the Minister who's been asked to coordinate government policy around drugs in coordination with the new joint unit, cross-government joint unit, which the government has established in response to Dame Carol Black's report. We understand from the Beating Crime Plan that the government is planning to publish a drug strategy by the end of this year, so we shall look forward to that and to seeing in particular whether there are more resources potentially available for treatment as we go forward. But it's felt like a good time to be publishing this report. I think what we're saying, alongside what Dame Carol Black is saying on a similar set of issues, I really hope will have some impact on the national debate going forward. But let's take some questions. Kevin, are you going to read some of them out for us?
Yes, absolutely, Justin. I'm just having a look over to see the great number that have come through. There's obviously a enormous amount of interest in the topic, given everyone's attendance today. Just looking through where to begin. Right. Okay. Okay. Well, one of the questions is, does the review apply to alcohol as well as other forms of drug abuse? And Lisa, I believe you might be able to answer that.
Yeah, we started with a hope that we could cover both, because obviously there's a lot of overlap, but we really wanted to focus really clearly and do the subject area justice. So we focused on drugs, and it'll be a matter of consideration about whether we can pick up some work on alcohol going forwards.
Excellent, thank you, Lisa. Another one that's come through, and this is for I don't know, perhaps either Justin or Lisa. How are those leading this review lining up with DCB review and new drugs unit and forthcoming national drug strategy? And also the ADPH support English Substance Misuse Commissioner's executive. Also, it says there's an LGA-led conference planned on the 28th of September. That's quite a long question.
Thanks, Kevin. I mean, in terms of as I mentioned, in terms of joining up with Dame Carol Black's review, I'm briefing Dame Carol as it happens tomorrow on the findings from our thematic, and I was a member of her expert advisory group alongside Sunny and various others. So I think we are reasonably joined up. And as I mentioned, I also had a chance to brief the minister last week, and we have this opportunity of the drug strategy later this year. So I'm hoping that that this is an important contribution to the evidence on why a drug strategy is needed, and some of the areas we would hope it would focus on in relation to probation activity. Interesting to hear about the LGA conference. If a speaker from the inspectorate would be helpful, we would be happy to line someone up for that, I think.
Okay, thanks again for that. There's another question here for, I believe, Lisa. Is it possible to say what proportion of the cases focused on women considered in the report?
Yeah, I was just having a rumble around my database to see if I can just light on that statistic. I can't recall for it just off the top of my head. Women account for just under 20% of the generic caseload, but we did see a higher number of women who had drug problems who crop up on probation caseloads. With it being a qualitative sort of inspection, we did only see and speak to a handful of women. It is quite a small amount, probably around 25%, but I will double check and I'll pop it in the chat when I find it.
Excellent. Thank you, Lisa. Just looking through again to see any other points that audience members would like to make or things they'd like to learn. I think the point about alcohol was already addressed. There was a separate question on that. Just looking through. This would be for Sunny, and it says, Sunny, have you had any contact with the Birmingham Liaison and Diversion Service Our main focus is the development of lived experience staff and peer mentors employed to develop the service. I don't know if you're aware of that in any way.
Yeah, thanks for the question, David. Thanks, Kevin. So with my role, my national role with NHS E&I Health and Justice, of course, I'm aware of, pockets of really good work that are taking place in terms of developing lived experience. And one thing I would say is that, that there are really fantastic programs that have been developed, like the Inclusive Workforce Program, which is looking at encouraging more people with lived experience to enter the health and justice NHS workforce, which is fantastic. So I think, yeah, absolutely, there are pockets of really good work taking place. And I think, what we need to look at at a system level is how consistent that is. So, for individuals who perhaps are in touch with the criminal justice system or are accessing probation for supervision, they may not always kind of fit into where there's a really good model that's taking place. So my dream is that, and my hope and aspirations is that, we have consistency across the board. So, where there's good pockets of practice, which the report has picked up, how can that be replicated? How can we ensure that, okay, there might be slight differences to the way in which it's set up, but regardless of where somebody might end up, I think it's important that they are able to access the same level of support and opportunity.
Thank you, Sonny. I think that answers it very, very well. Looking through, I'm not seeing too many other discrete questions other than will a copy of the video be made available? I'll just reiterate that, yes, we will be sending a link to the recording and the presentation, as well as a short survey to get some feedback if you're able. It'll be about 4 questions, as I recall, in a very quick survey that we'd appreciate. I'll have one last look in the chat.
Kevin, yeah, I've seen a couple more questions, Kevin.
Are there?
Might be worth, yeah. So there's a specific question from Marilyn about, is there a plan to include training around autism for probation staff? I think that's probably a question for the probation service itself to answer. We've separately done some work with prisons inspectorate colleagues on neurodiversity and the evidence around that, including some useful roundtable discussions with probation staff and others around the country, which showed a really clear need for some training around autism and other neurodiversity issues, and are hoping that the HMPPS will respond positively to that. I think they recognise there is a real need for that. So very good question, Marilyn. Might be worth you having a look at our report on neurodiversity, which came out a few weeks ago. I think there's a question from David Harmon saying, how involved has the prison service been in this conversation, given that the journey towards tackling drug issues starts on their premises? I think, as Lisa's report was showing, there's a real issue with joining up people leaving prison to treatment after release. That fact that only a third actually are getting the join up. And one of the really interesting bits of data that Lisa tracked down is what happens to those third. For that minority of people who do get into treatment, how many of them actually are retained in treatment? And we found that only a third of that group of the people who do actually get retained for 12 weeks with a high dropout rate. I don't know, Lisa, do you want to say anything more about, did you involve prison colleagues in your thematic inspection or talk to that side of the system?
Thanks, Justin. Yeah, we did. We spoke to some prison governors, some resettlement staff, some at the time the CRCs were still in operation, and we spoke to some through the gate staff and various people working through the gate and in prisons. And it felt like there was quite a siloed approach because health and justice work a little bit differently. And we had conversations about how we could improve that. And it is a difficult thing to get right. Where we saw it working the best was where we were seeing video calls or telephone calls being put in place before people were leaving, so relationships could be pulled together and that people knew what was happening to them and with them before they were actually leaving to go back to the community. So that was on the upside. On the downside, we found cases where people, there was one service user who slept in a public toilet on the first night that she left prison, without a prescription being available to her. So I think, we've seen some fantastic work, and whilst there's some quite gloomy messages in here, I wouldn't want to diminish the very strong efforts that lots of people put into this area of work. But I think as a whole, there is an awful long way to go, particularly on helping people not be those revolving door experiences that they've experienced, you know, going in and out, short-term custody. It's very difficult to make progress. And I haven't covered it off in the slides, but whilst I've just got the stage, I'll just say it. Some really lovely work on recovery that's happening on incentivised drug-free living wings and mutual aid in custody, and then often those steps that people are starting to make sense of how they can kind of work towards their recovery is not held and maintained and underpinned as they leave and go out into the custody. So yes, we need people to get their medicines, but we also need people to get their social and peer supports, because it's a complicated thing saying goodbye to drugs. So yeah, real opportunities, and the pandemic really hasn't helped, you know, but I think where we've seen pockets of it, it was good.
Thanks, Lisa. And it might also be worth saying, I think we found an interesting contrast in Wales, didn't we, where in South Wales there's been some much more joined up commissioning of services, so the same set of providers operating in prison but also in the community after release and in police custody as well, so a real greater sense of join up around that agenda in Wales. There's a question from Dave Burrell saying, is there any information showing how the lack of temporary accommodation for probation clients or prison leavers and the impact it has on people who are struggling with substance issues? Lisa, you mentioned the woman who had to sleep in a public toilet, which was
No. I think it's interestingly, Dave, I think what we found was that the Everyone In campaign that came about because of the pandemic actually did help people with substance misuse problems. So generally speaking, we didn't see a great deal of street homelessness in this population in the sample period that we looked at, because it overlaid with the pandemic period. So in terms of that homelessness prevention activity that was going on centrally and locally, many people were more protected in this period. However, people struggle to maintain tenancies, and sometimes people, even in some very proactive situations, we saw a great series of work in Blackpool from the Housing First operations, really trying to support people to stabilise. But people sometimes really struggle to even maintain those tenancies often because of real strong mental health difficulties and crises that they're in. So it is a very holistic thing to look at, and it's a great question, Dave. Thank you.
Lisa, William Haydock was asking, is there more insight on the factors behind the decline in DRRs and pre-sentence reports? Is it because services can't cope with the demand, or people stopped asking?
Great question again. I think there are some factors that have played into this. There's been a lot of work to speed up cases through court and streamline services and processes to make sure that people can get speedy justice. One of the things that's happened because of that is more on the day reports are being made and less more considered reports are being collated, which squeezes out a little bit of time for more complicated situations, and people with entrenched drug difficulties often need a little bit more time to think through how they feel motivated or what the barriers might be, and whether or not there is some viability in having a go or another go at some treatment and recovery options. And you can't necessarily have a quick conversation about that. So I mean, we didn't see as much work as we would have liked to in terms of joining up things like arrest referral, where you've got more time to talk in cells where somebody's been arrested and there's an issue. I'm trailing it now, but we will feature a little bit of that in the effective practice guide, because I think there is some good clues about how you can have some of those quality conversations. I think also the rise of rehabilitation activity requirements in orders, where there's a treatment need, people are not always getting treatment, they're getting rehabilitation activity requirements. So I think there's a mismatch in some of the sentencing. I have my own views about why some of that's happening. it might be easier to sign up to. Defence solicitors might find it easier to plead that case for clients. But certainly we've seen a real decline in the number of orders being made. I don't think there's evidence to suggest that the treatment services couldn't provide the numbers of places, but we do see very few criminal justice pathways now existing in drug services because of cuts to their budgets too. So I think there's just been a decline in focus in this policy area, and lots of agencies want to do a great job. They don't always have the resources to do that, unfortunately.
Lisa, should we take one more question, because I know we have to wrap up in a minute, but we've had a question about workforce challenges. Did you find workforce challenges in the inspection?
Yeah, we found about half of the case holders that we spoke to were saying their workload was too high, and that to do the detail work that you needed to do to really support people with holistically with problems, that they needed more resources. Other workforce, there's been a real decline in specialist training for probation staff, and staff who'd had trauma-informed inputs found it really valuable, but then there wasn't much follow-up to actually have some clinical supervision or support to help them really think about how they'd use that in practice and how to develop that quite complex and difficult work. So big workforce challenges, I think.
Yeah. Thanks, Lisa. I think we probably should start to wrap it up then. I know there are questions that have come in that we haven't been able to answer, but we'll try and answer those that we haven't managed to so far. Sunny, any final reflections from you?
Nothing other than to say, I think, we have got an opportunity to bring a few different reviews and reports together. Let's not wait until all the data and all the stats are showing us that the picture's getting worse. I think it's a real opportunity to kind of, take on board exactly what the state of play is, and hopefully do the right thing to improve the experiences of people who are going through our services. And like I said before, let's really centrally include and take on board that lived experience. It will help us in more ways than we can imagine.
Thanks, Sunny. So can I just conclude by saying many thanks to our presenters, to Sunny and to Lisa, for some excellent inputs. Particular thanks to Lisa, who will be leaving us at the end of this week to take up a job with Public Health England as a program manager on Operation Adder. So I'm really pleased that she's going to be able to continue her work in this really important area. Can I say thanks to Kevin and to Aisling for their help with logistics as well, and thanks to our group of expert advisors who we were able to bounce ideas off and ask for further help with. And I've noticed through the participants list that we've got at least 5 of them on the call today. So in addition to Sunny, thanks to Mignon and to Danny and to Martin Blakeborough and David Best, it was great to have you involved in this work as well. Kevin, any final points that you need? I know you're going to do. We're going to ask people to fill in a very brief questionnaire just to check how we always welcome feedback on these events. But anything else, Kevin, to say?
No, I think that about covers it. It is very much, just wishing to thank all the speakers for, their investigations and their, insights, and of course their time here today to present to all of us. Yes, there will be a very brief survey of 4 questions that you'll receive through the Eventbrite, the same way that you received the link to this event today. And of course, we will, I'll say again, be making this video and the slides themselves available on our website, so that you'll be able to revisit them again. We appreciate that we've taken a very, very large report and tried to present it in quite a short space of time, but you'll have that as a reference.
Thanks, Kevin. And you can see the report itself is on our website and the press notice as well. So do read the report in full if you get a chance. It's well worth a read. Look out for the Effective Practice Guide when that comes out next month. And thank you all for attending. I hope you've all found it useful.